Hi, and welcome to the No Scrubs podcast by Melanin Medics. We're your hosts, Ife
and Tenni, and the No Scrubs podcast is an opportunity to listen to what we get up to at work, outside of work, and everything in between.
So sit back, relax, and listen to us yap about being doctors. Now, as you can see today we have a special guest, medical student, influencer, Fejiro.
I love that the confidence went down.
Guys, the reason that we're laughing is because we were talking about how to pronounce her name before, and we were saying that, like, because we have English accents, we just say our names in an English way, even though that's not the real
it's not the real pronunciation.
So I just invite you to teach us all, listeners.
Welcome to Robo School, where today we're going to go into the pronunciation of Fejiro.
Wow.
So Fejiro is unique because the full name is Ogene Fejiro.
Oh my god!
Yeah,
Tell us what your name
Robo.
is.
Yeah. Ogene Fejiro.
My mum is Sickle.
Really? Love that for us. So Ogene Fejiro means God is worthy to be praised.
Amen.
Ejiro is like the roots of that, so it just means praise. So yeah, Ogene, God, praise, God is worthy to be praised. So yeah, that's my name. And I feel like when I say Fejiro, it takes away all of the accents, and I feel like it also rubs away from the fact that it means praise. And so that's why I'm thinking like, This is the point where I need to transition back to saying my name the way it was supposed to be pronounced.
Do you think we should? I don't know. I feel like when I say my name, how it's meant to be pronounced, it's just a bit too Ife.
But that it's two syllables.
It means
It
love.
deserves the oomph.
Ife is still vibey, like I feel like Ife still gives.
Yeah,
do you know what I mean?
I do believe it gives.
It gives.
It would give more though.
It would give more.
Yeah,
but it's the accent switch.
Yeah. I get you guys.
Actually, am I going to try this?
Go on then.
Okay. Well, I usually go by Tenniola. I should apparently be going by Tenniola.
Teniola. Yeah, it sounded really good.
What does it
Yeah.
mean?
The accent change. Mat of wealth.
Mat.
Like a blanket of wealth.
Okay.
Wow.
Interesting.
Sorry.
Yorubas are so creative with their names.
They
You're
are.
Yoruba, aren't you?
I'm Yoruba.
Yeah, they're so creative with their names. That's amazing. Mat of wealth.
I feel like we're all quite well acquainted, but I have some icebreaker questions.
Go ahead.
Just to get, when I sent you the email, I didn't tell you what the icebreaker questions
Oh, did
would
you?
be.
I didn't even read.
She didn't
I'm
read
so
the email.
sorry.
She replied to the email being like, thanks, it looks great.
I always do that. I'm so sorry.
And she didn't respond. Okay,
Let's go.
the first question is baby names related to medicine, boy and girl. Last time we did what did we do last time?
We said like if
you
you
could
were
be-
a drug.
What would you be?
Yeah.
Now it's baby names, anything related to medicine.
Anything.
What?
Boy and girl. Whenever the idea comes to our mind, just say it.
Tazzacin.
Tazzacin for the boy or girl. That's actually quite good because you can say Taz. You can say Taz for sure.
Oh, Taz for the boy.
Tazzacin for the boy.
Tazzacin was a nice girl's name.
Okay, I feel like it's kind of unisex because, like you said, it can be Taz.
Taz.
It's a nice
That's
name.
good.
I've actually played this game at work before.
Oh, wow.
With surgical instruments.
Oh, whoa.
Pretty much, I have a colleague, and her daughter's name is Alice, and Alice is a surgical instrument. So we always joke about
Yeah,
that.
it is. Yeah.
So we'd be like, Alice, and we'd be like, you want your daughter?
I love
So
that.
we said, what you want to call your son? Langenbach.
Langenbach is that sounds like old money.
Langenbach.
That sounds like wealth.
Langenbach, darling.
It does sound
I love
pretty
that.
good.
You made it work.
So I'll go for Alice and Langenbach.
Yeah.
Alice and I haven't even thought of one, guys.
Jeez.
Let me think. I can't think right now. Someone else has to go. Oh, I have got one. River Oxaban.
For a boy.
For a boy.
River.
And then short for River. River. That is very cool.
No, sorry. Your kid is gonna. Your kid is going to get mocked at school.
River. River's a good
River
one. Okay, now we
Oxaban.
need to think about girls' names.
I don't know why scapula keeps coming to mind.
No,
You're
not scapula.
Serious.
Amygdala.
You're not serious.
I don't know. Let me think.
Cortisol.
Not bad. Not bad. You're doing quite good. You're doing well.
Cortisol.
Let me think.
It's not okay. How
I'm
can you be
frozen. I
the
can't
stress
think of
hormone?
it. Yeah, that's not a good omen on that child's life.
It's not a good vibe. I really am stumped. Like, first of all,
stumped
I'm
with girls'
intercalating
names.
anyway. So, like, all the medical knowledge is not even in my
What are
brain.
you intercalating in?
Masters in global health.
Ooh. Oh,
Thank you, guys.
I love that.
Thank you.
Okay, so we don't have any girls then. We just have boys.
Global health, done it.
Yeah. Ooh, she gonna be like a acronym, like COVID-19 or something like
Pandemic Demi.
First of all, why would you do that to your child?
Global health, you know what?
Why would you do that to your child?
People did call their kids COVID and Corona, you know.
No, they didn't.
They did. They were twins, and one was called COVID and the other one was called Corona.
People are reckless.
Their capacity should be assessed. What the heck is that? That is crazy.
Reassessed immediately. I think the kids should be taken to the care homes because social care homes. Because please, social services be called.
Okay, so my next icebreaker question. This is just more of a discussion point in relation to our topic of the day. But has everybody watched Supercell?
Oh yes, absolutely.
And what were our thoughts?
Oh, incredibly empowering.
Okay. Yeah.
Oh, I thought you were going to say you didn't like it for a second.
No, okay, it was very gory though. Towards the end, it was like, no, I didn't need to see that. Like,
there were some gory parts.
Yeah, too gory for my liking. I'm not into the whole.
Oh, no, that's
yeah, that was very. That's your bag. You are a surgeon, so I understand that. But like, I can't deal with that. It's too much unnecessary, but very empowering. I loved how it's in the cultural conversation now. I was even talking about Supercell yesterday.
Really?
In a different panel.
I love it. No, I actually love it.
Good. I wanted to like not watch it whilst it was like the hype was around it. I was like, wait.
Oh no, you can't wait. You can't wait. You have to be in the conversation.
I watched a little taste episode to warm myself in, and then I
floodgates. Floodgates.
I watched it so quickly. Like I was really surprised, and I liked how Supercell means having a sickle cell trait. I'm like, wow, they made it like into a superpower. I thought that was really cute.
He was explaining it to Simply Sayo that if you have you're gonna have the supercell if you have a loved one with sickle cell and you don't have the disease, so you don't have the condition. And I don't know if I don't think you'll be a carrier.
Without the trait.
Without the trait.
I've heard Simply
Sayo.
right there.
Simply Shayo, sorry. Shayo, sorry.
After our conversation. But like, because her sister has sickle cell. So obviously for her, like that's also something really beautiful to be able to see go forward and like.
No, she's been pivotal in the public conversation about sickle cell.
Definitely.
And to bring that conversation to light, especially with creators in the influence world. Like, I just love how when there are creators out there who are really public about a specific cause and advocating for that continuously, it really builds up a beautiful narrative that yes, you can be so vulnerable and you can put yourself out there, because I think she has lost 2 sisters to sickle cell, and it's really heartbreaking to hear her story, but actually it's the work that it's doing and how much she's done for like even just raising awareness and working with NHS and all these amazing organizations. It's just so inspiring to see that this conversation can continuously be in the public eye. So yeah, she's doing amazing.
Yeah, no, it was a really good show. I think it was needed.
Yeah,
I think. And which superpower did you think was the best? Like, which superpower would you have out of all of them?
There wasn't a time traveling guy was the main character. I appreciate that.
Yeah,
I feel like
because he could make things stop as well.
Yes,
he could freeze time.
Not like it changed anything in the end.
But that's
like,
the thing, it's actually quite heartbreaking knowing that you'd like can go back.
It was the worst thing. Like the whole point of him.
But the thing is, it's his girlfriend's fault. It's Dion's fault.
How is it her fault?
Go home, Dion.
Go home.
Yeah, it's true. Actually, she shouldn't have stayed in the car.
You see men fighting, and then that girl in the middle, like, stop fighting, stop fighting.
Get out the middle. Get out the middle. Get out the middle, babe.
She had supercell, fair enough.
But she didn't. Please, she was like, oh, do you know what? I want to come with you. Let me just spend my last day. I would be like,
but to be fair, no. Honestly, if that was my man,
I'd be like, let's go home together. I'm already gonna die, so let's go home together. Like,
that was
I don't want to spoil it for people that watched it.
It's too late now.
It's actually irked me.
Yeah, what did it irk you?
You know, there's that guy that they figured out could heal himself.
Yeah.
I was waiting for him to heal her.
But maybe he can only heal himself. I don't think he can control it.
Fair enough.
It's true though, because all of them at the end were just standing and looking at them.
I was like, yo, someone do something.
Yeah. He was like, call 999 or something like that. He was bare like, call something, and everyone was just looking at him, just blank face, like, guys, did something, mobilize.
Exactly.
No, they weren't doing anything.
I don't think the time travel one's the one I would have gone for.
Which one would you go for?
Just because he couldn't do anything.
But like in general life.
What are the other ones? I'm actually forgetting.
Gonzalez.
Oh yeah. He was a very very good character.
Why?
I don't know, like, if you haven't realised.
To be fair, yes, very useful as a doctor.
I'm always doing like 50 things.
Very useful.
If I could do those 50 things extra quick.
Bruv, and you'd save money on transport. Excuse me? I need to go from Kent to London. I could
the time travel guy can also just like bounce from place to place.
He could. He actually could.
I don't have to run. I don't have to do any work.
That is actually a very good point.
I just appeared.
Just
then you mean A&E? I'm just there. Do you know what I mean? I'm just there. Then you mean A&E? I'm there.
No, you're actually very smart. I'm going back to time travel. Sorry. Yeah. I feel like I keep hopping. No, I'm back. Back where I started.
You'll soon choose mine. I know you.
No, telepathy though. Wait, is it telepathy? What do you call
that? To read people's minds.
No.
Where she can move things.
What's that thing called?
Oh, telekinesis. Is that useful?
What would you need to do with that?
I don't need to move my hands. Done.
But that's kind of like robotic surgery anyway, and you guys already have that.
Okay, but to be fair with your mind, you're not feeling. Sometimes you need to feel.
You do need like that tactile feedback for surgery. I guess he's got the best power.
But there's one more that we super strength.
Guy, please. And then there's the invisible one.
Super strength is useless to me.
The strength is useless.
Yeah. What would I use that with on the practical day to day? I don't want to be. Sorry. I don't want to be the man dem. I'm in my soft feminine energy right now, and I don't need that super strength making men think I'm man. No.
Thank you. But anyway, let's be serious now, because we can be talking about TV for ages. Fejiro, we know that you have sickle cell. Mm-hmm. Tell us about how that influenced you wanting to study medicine and your journey into medicine in general.
Good question. For me, having sickle cell was like the eye-opening. Like, it's basically the door opened into the hospital world and the world of medicine for me. I was in Nigeria. So I was born in Nigeria, and then my parents moved here when I was 7 years old. Mm-hmm. And so I remember most of the pediatric care that I got in the UK. I don't really remember much in Nigeria, but I was... I think I was like frequently ill when I was younger, especially when I came to the country because of the weather changes, and that was big on me. I had my first blood transfusion, I think, a few weeks into the country, and that's the only blood transfusion I've ever had, because that sickle cell crisis was really, really bad, and I could have died if it wasn't for a Nigerian doctor who realised how sick I was.
Wait a sec, pause for 1 second. I'm sorry, guys, I keep pausing things. Did you write about this in your personal statement?
No, I did a video about it with the NHS Give Blood.
Because someone else's personal statement was like this I reviewed years ago.
Was it?
So I'm like, was it you? I don't remember the name.
I don't think it was, because I didn't really write much in my personal statement about... I think I did it right, like in the first sentence, but not much in it.
Okay, sorry, continue. Sorry to interrupt,
I actually have another interruption.
Oh, go ahead.
Give it like... having a Nigerian doctor, you said, is what you realised what you were actually going through.
Oh.
Obviously, there was other healthcare workers.
Oh, yeah.
So, did you find that you weren't taken seriously?
Yeah, no. This is to my parents feeding back to me, because I think I was around 7 or 8 at the time, so I didn't remember this. But they said, when we got to A&E, no one was really understanding what was going on. They had to explain sometimes to them like what sickle cell was and like what I was going through. And when you're a child, you're in the pediatric setting as well. And this is the thing that I've realized, like, even though I see and hear a lot of feedback from people in the adult setting not believing them, it's really shocking when you think about someone bringing their child into the hospital and being in the pediatric setting, and still people don't really know what's going on with a really common condition like sickle cell. So anyway, that was the experience. I had lots of healthcare professionals just not really like taking it seriously. And then I think it was a changeover. So a ward round started, and there was a Nigerian doctor that was also part of the ward round, and he looked at us. I had jaundice, like really jaundiced eyes, looking really pale, just looking very like weak and fragile. And he was like, you really need to get a blood transfusion really quick. And my mom said that when he came back after I had had the blood transfusion, he was like, that saved your life. Like looking at your hemoglobin levels, looking at how bad it was, that saved your daughter's life. And to me, like hearing that story back, one, it hurts me because of the fact that it was in a pediatric setting, and how heartbreaking that was for my parents to maybe be an advocate when they are new to the country, don't really know the system, and don't want to upset, because Nigerians have a thing for respect with doctors. They don't really want to step on anyone's toes, but actually to feel like that still wasn't, like their child still wasn't a priority, like that really hurt me, like retrospectively thinking back on it. But encounters like that and hearing my parents' feedback to me, and also just generally remembering my experience of being in the hospital, I think aside from that, like I generally did have like I thought I had like a decent time in the hospital. Like I was always looked after, like the pediatric setting was a very lovely environment. Like people were also intentionally caring when they know that a child is in pain. So I think for me, I was very like, oh, this is a nice place. I kind of wonder what it would be like to be a doctor one day. I think that's where that conversation started. And when you tell a Nigerian parent that you want to be a doctor, I'm so sorry, you can't have any other career decisions in life.
And from there, you're like,
and from there, everything happened. Oh my god.
Yeah. So I think that's how it kind of looped in together.
And did you ever at any point think, I don't know if I want to do this anymore? Like, I'm not sure. Like from that time, you're like,
I think that kind of like, do I want to do this? Was probably more recently in medical school. Currently still a narrative that I'm playing with, I can't lie. I think because of my master's in global health, I've had the privilege of seeing like how medicine is in different sectors. And I'm actually very interested in how that works, like maybe not medicine in the clinical sense, but medicine in a corporate sense. What does that actually look like? What do you mean? Yeah, like stuff like health tech. I was speaking to Lamde about this. Yeah, we love health tech. I love how health tech is revolutionizing lots of different things, even with pain management, pain assessment. Like, I'm just really interested in like that whole world and exploring that. But also with global health, I think instead of field medicine and like going into the disasters, what about the project management of the disaster? Like kind of it from the back end and from the people that you can't see. That's really kind of interesting to me as well. So I'm kind of toying around with this concept of corporate medicine. What does that actually look like? Because I would really not want my body to be stressed in the workplace. And I feel like I don't see that happening in clinical medicine. Like it's very stressful, high impact, high pace, and I love it, but then I also want to respect that I have limits with my health as well.
And how have you found that in terms of like going through medical school? Like, do you find like the university are helpful? Like, are they supportive? Do they make adjustments? Or are you just out here,
fight for my life,
fight for your life on your own?
No, it's actually really good. Like the support that I've gotten from Keel is actually really heartwarming. I think from one of my very first encounters was meeting, she's retired now, but her name's Dr. Carol Gray, I think. And it was first year. I think it was like maybe my first week in. She just sat me down. I think I was a one-on-one meeting with her, and she was like, "You're not the first medical student to have sickle cell, and you won't be the last person to graduate with sickle cell." And I was just like,
so sweet.
Yeah.
I love that she could graduate on that as well.
Yeah, life into your
like I love you won't be the last doctor who has sickle cell, and basically just had that like conversation as to what can we do for you, how can we support you. I think I also had to relearn how to communicate the fact that I had sickle cell, because first of all, it wasn't even relearn. I had to learn because my parents, they didn't want that to be communicated to the world. And that's troublesome because I'm a content creator. Everything is kind of like, this is me, this is da-da-da. And I think they also had to get comfortable with that as well, because I think me being public about having sickle cell has allowed other younger individuals with sickle cell to also maybe get the confidence to say that they do, and that in itself is amazing. You can get so much support when you do speak out about it, and I get there are some university students who still feel to this day, oh no, I don't want to tell them about it. What will they think? What will da. But there is support. I mean, for example, in first year, I remember during an OSCE station, like an OSCE round, I had a crisis in my back. It was like really painful, and back crises are they're extreme in the sense where that you just don't feel like you can walk, you can't really breathe in deeply as well. So it's just really limiting. And I was supposed to go around this circuit and still do like 2 more stations. Thankfully, I had a rest station in the middle, and I had told them beforehand, hey, can you carry my medication with me, because I can't carry it, so the invigilator has to go around the circuit with anything that I need. So I think I had my water bottle with me, but I told them, hey, I need ibuprofen. So during my rest break, someone ran down and gave the invigilator my ibuprofen, and I took my ibuprofen, and it helped a little bit during that.
And were you still able to complete the circuit?
Yeah, I still did it.
You were still in pain?
I was in pain. I was not going to stop so I can get reevaluated and do a repeat OSCE. We're going to finish this today. I feel like that's my mentality with like a lot of like, even when I'm in pain. And I think a lot of people who have chronic conditions or acute conditions still have that kind of hang up, like, I don't want to do this again. Like, because the stress of going through an OSCE or even just exams in general, it does a lot to your body, and the concept of having to go through that again is even more terrifying than finishing it. So
do you ever feel like you're pushing you ever push your body to the limit where you're like, oh, maybe I should have just rested? Or do you feel like you're at the age now, or like you've got to the place where you're like, you're okay. Let me finish.
I really should. Tussling on a day. I think one of the things that I've learned over the years is the concept of pre-planning for loads of these like stressful situations, because you know them in advance. You have a date for your OSCEs, you have a date for your knowledge paper. And so for me, it's kind of working backwards to know, okay, the months of preparation that maybe I need to put in, as opposed to maybe other medical students, because, you know, they can do the all-nighters, they can do the staying up in the libraries and maybe just working alone and hustle, grind. Whereas for me, I feel like I maybe have or need to have a different understanding of how my body works, because if I do hustle, grind, and I don't sleep and I don't drink and I don't eat and I don't do all these normal operations, my body is going to just collapse. So I think it has put a little bit of a pre-planning awareness in my head, and maybe made me a bit like, maybe too planning, like hectic. Like I feel like I'm very much, I need to know the strategy, the plan, the this, the that. And I think that's probably because I need to mitigate for that stress level that I don't really want to experience. So I say yes in a sense, but also no, because even though I know that I do need to pre-plan, life can get life, and you can just feel like, oh no, I've got time, I don't want to do that. And eventually it will build up and they'll be like, oh, I wish I started earlier. So yes and no, in a sense. I'm still, exactly.
Life is a journey, isn't it? It's all about learning from your mistakes. You're still young anyway. How old are you? Like 22?
I'm 24. Exactly.
I'm so old.
Aged.
You're the same age as my younger sister.
Stop here.
Baby.
Okay, I'm growing gracefully.
Have you thought about into the future in terms, I know you spoke about like corporate medicine and stuff, like, have you thought about any future career or personal goals that you have? And if you think there are any challenges that having sickle cell or any other challenges that might arise?
Ooh, yes. So I do have loads of like personal goals and personal endeavors outside of medicine. I of course I create content for myself, but also have started creating content through a social media social media agency that me and my friend co-founded recently. So it's called the Rika Collective. It's a play on our last names, and it's basically an agency that is founded on the principles of collaboration. So we want to collaborate with creatives on social media campaigns and really working together to put people's social media in an aesthetic and purposeful way.
Oh my God, I love.
So yeah, we're really heavy on like collaborating with other creatives, and I think stroking my creative brain, my left brain outside of medicine, has really kept me going, because medicine is creative, but not that creative.
It can be. But I think it is important to have these little things outside of medicine, just so you feel like generally fulfilled.
Yes, absolutely. And I think that's really close to my heart as well, because like with medicine, there is like a sense of, yes, you can be creative, but it's also very much yes and no, yes or no. Like there's no kind of like, oh, you can do this or you can do that. Like it's all, there is a right answer. There are guidelines. There are set rules. Exactly. So with social media, there is deviation. There is, oh, let's try this. What will happen? Like there's so much openness, and I think that's really important for me to really be in a space where like I can decide, I can make decisions, and there is no right and wrong in a sense. So I think for me that's a personal goal. I really want to see the social media agency grow, and for us to really continue working with like other creators. We've got like our first 3 reviews 5-star. Well, I think the third one is a 5-star. I don't think she's published it yet, but the first 2 5-star reviews, and I'm just like, oh, this just makes me so happy. Like I just want to continue growing that, and continue stroking my creative brain. And I guess with that as well, there are there are limits, because even when I'm on content days, it does put a toll on my body. But we want to build the agency to a point where we are like collaborating with other creatives, so it's less stress on us as the co-founders initially. But yeah, it's the growing pains of like starting something out. You have to really put in like energy and effort into something to build it.
It's true.
And
I
it's
find
stressful
that
in the
difficult,
beginning.
because I've recently started, like, I'm always doing something.
Yeah.
I'm always doing something.
Yes, ma'am.
But I find that like medicine is like, you know how it's like there's like guidelines, like a set pathway, and I feel like that sometimes it's comfortable, like doing something on your own, or and it's like when it doesn't go right, it goes, you're just like, well, do you know what I mean? I find it's actually, it can be really fulfilling and really great, but it's also, it's kind of stressful when you get no's or things don't go as planned, and it can be a longer process to become successful, and it takes a toll financially. It's a lot. But
speaking to the choir here.
It can be disheartening, but I think at the end of the day, it's still important to persevere, like you said, and just pour into it.
Oh, absolutely. And there's so much fulfillment as like well with it, because our goal, especially with the creatives that we're working with, is creating opportunities for them. And we've done like our first 2 hires, and that for us was really, really fulfilling, because that's the whole point of us being like doing social media from this perspective of working with creatives and hiring them and saying like, we want you to also be as part of the brainstorming and like, you know, the content ideation process as much as we are as the agency. And that's really fulfilling to have to be working on a goal and to see it accomplished, even though there are hang-ups. And yes, you will have people that don't pay on time, and there will be arguments, and there will be things that, you know, that come up, and disagreements and this like that. But I think for me, it's really seeing a goal become an accomplishment, or like just working to be an accomplishment, that I feel like is very novel, that feeling, because yes, medicine is very prescription, and like it is, you know, if you follow the guidelines, it's what you should do. You're not rewarded for doing it. Like you're not given a pat on the back for prescribing what you should prescribe. It's what you should be doing. You know what I'm saying? Even if you go above and beyond, it's like, oh, well, you're just being a doctor now. You know? It is. Yeah. So I think if you go above and beyond for your own thing, it's like, wow, this feels amazing, because the reward is directly matching my effort.
Yeah. It's true.
You're inspiring me to actually like go back and like work on the little projects that I've been like
Good do it.
I actually saw this TikTok the other day and said that the NHS runs on goodwill. Like it runs because people stay late, people push themselves. It's not like we get. It's not like you said, that effort. Yeah. We don't see like a big reward from that. It's just what we're expected to do. Yeah. When you're doing your own venture and you put that energy and effort and go the extra mile, you actually get something back, and
but
it's like
dopamine rush. It's like, ooh, yay, let's do more.
Let's do more.
Yeah.
And why I say, like, I know you spoke a bit about how it was for you being in the hospital when you were younger with sickle cell. Like, what do you wish people knew about sickle cell disease, like especially like healthcare professionals? Is there anything you think in terms of education that's lacking, or the way that we could be treating patients with sickle cell better?
Yeah. Because my master's study is about how the pain we express is not the pain that people perceive. So that's in particular in reference to sickle cell patients. A lot of it has been like really interesting, because when I've interviewed my participants that I interviewed were a mix of medical students and healthcare professionals, so clinicians, whether they're doctors, nurses, or I don't know, like physiotherapists who have encountered and treated sickle cell patients. And one of the narratives that's like coming out is this whole concept of how can we teach people empathy? Because empathy is the real thing. Empathy is the real like conundrum, and like how the pain that you express is not actually what I think you're going through. That's like the hang up in the middle. And I think for me, a lot of it is communication skills. I think like you don't really need to teach people how to treat others. Like, you know the guidelines. The guidelines are there. You know that they should be getting pain relief in this amount of time. Yes, there are pressures on the system. But one of the things that one of my participants said is that there's a level of psychoanalgesia that you can give to a patient by listening to them. Ooh. And that's really deep to me. Like, you can soothe someone's pain mentally by simply that conversation that you have with them, and the questions that you have, how you probe into it, and how you make a patient feel. I think that's one thing that I would really love to to build a foundation on in terms of this conversation of how we treat patients with sickle cell, families with sickle cell. It's the psycho aspect of like how we listen to them, how valid someone's pain feels. Exponentially increases by the conversation that you have with them, and how you don't dismiss them, how you don't cut them off, how you do pay attention to what they're saying and you probe into that further. And I think that's really, really important. I don't know how that comes across in clinical medicine. Maybe it's communication skills. Another thing that also has come up is personalizing what you're teaching people by a story. And so there is an organization that does go into sickle cell education. I think it's called the Sickle Cell Education Series by, I think the founder is Dr. Rosby. And he was telling me about one of the cases that he's done with healthcare professionals where they showed a video of a mother who lost her son to sickle cell. And it was in the hospital that they were teaching the healthcare professionals at. And the doctors in A&E, and the outcome of that sickle cell education series was very impactful, because they got to see how their decisions, or the decisions that are made clinically, affect the life of someone. And he said something really empowering. He said, where we as healthcare professionals are in a network of memories. So you might not remember that patient, but you're in that patient's network of memories now as a doctor, because of what you said or what you did, or how you.
That's scary.
Yeah, it's very deep.
It's true.
Yes.
I was just thinking about what you were saying in terms of education about empathy. And I remember the one time that I'm not a medic, but it was whilst I was doing medical rotations, and the one time we did have a patient who came with sickle cell, I just remember like trying to like understand how people were like interacting with this patient. And I felt like the feel around it was that query drug seeking behaviour. And that's I feel like that's probably quite a common thing. Like you see, is this someone who just wants morphine quickly and then wants to leave the hospital? And I think it's like kind of important for us to be able to, it's a difficult thing to distinguish generally. But I think there does need to be a greater understanding of what people can actually be going through, and I guess taking that time to sit and to listen, and like will make such a drastic difference, both in the way that the patient's experiencing pain, but then also in how we're understanding their condition and why they're actually here. It does. That's crazy.
big thing. And it's like, I don't know how long y'all have, like. But no, I think the concept of like automatically seeing someone come into A&E and like jump into the conclusion of, is this drug seeking behavior, like that's just a bold leap. Like, first of all, hello, hi, my name is, like, you know what I mean? Like, can we start off by getting to know me, like, before there is a label attached to this person and what their behaviors are. And it's really heartbreaking that sickle cell patients automatically fall into that category because of our acute episodes, because of the frequency of how the body reacts to stress and pressures, that you will see frequent, like there is this term, frequent flyers, frequent attendees. And you're more likely, if someone has interacted with you in only one setting, like I'm a doctor, I only see you in A&E, I don't see any other aspect of your life, I'm most likely to think you're coming to A&E for a particular reason that's not genuine. But I don't see why that should be the conclusion. And I think it is down to empathy, and how maybe the NHS kind of the culture of the NHS maybe sucks out the ability of maybe doctors to empathize, because you see pain so frequently.
I think it actually does. I don't think it's also just in the context of patients with sickle cell disease. I just think in general you just get tired.
You do.
Like, I'm not even using it as an excuse, but I know that there's been times where especially when I was burnt out, I noticed that my empathy was absolutely nowhere. Patients were who? I don't have time for anybody. I was just stressed. I was going through my own mental, and I was just like, and I think a lot of like doctors and clinicians and nurses, a lot of us are tired. And that's no excuse, but I do notice that when people are burnt out, their level of empathy is
on the floor. It's really important. And the pressure of picking yourself up shouldn't just be down on the person who is feeling burnt out. Like the system in place should should be structured in a way that you shouldn't get to that level of burnout where patients are no longer a priority. Your sanity is a priority right now. Like the system needs to, I think in a sense, when you are working in, for example, A&E, there are some great A&E, I guess, structures that I've heard about where there are psychologists and they really they take the time, and there are maybe by fortnightly sessions that you can have with them and really discuss. Yeah, there are some A&Es. There are some I've been hearing, you know. There are some A&Es that really do, I guess, prioritize the well-being and make those structures in place. But then there are also other hospitals that maybe through financial stresses maybe don't have the capacity to cater for that, but there should be an emphasis on how you're preventing doctors from getting to that point. Even though there are financial pressures on the NHS, like there should be something in place, whether it's like, I don't know, I think just doctors coming together, like groups of like, hey, how did we feel about this? I remember there was a really tough case in A&E one time in Stoke, and they had a huddle afterwards, and I think that was very important. And I wonder how can that not just be for a very difficult patient that we've seen, but how can that be something that we do regularly and frequently and turn it into a space of okay, that was difficult and this is difficult, but I feel seen, I feel heard, I feel like what I'm going through mentally is what also other people are going through, and I find some sort of support in that. So that's really important.
I think unfortunately the way I've seen it pan out is actually that things like debriefs, they become so part of the many tick and check boxes that we have to do. That's the problem. That were debrief done, then moving on. Problems, no, cool, carry on.
I've never had a debrief. I've seen some things.
Really?
No debrief.
I think I've had
everyone just be crying in their corner on their own.
Oh really?
Really? Yeah, we have never had a debrief.
To be fair, I wouldn't say I've had many. It's just that one in A&E when I was on a medical assistant shift, which is basically you're paid to be a medical student on the A&E wards, which is really good. They created that job in Kiel, and it was a difficult, very difficult encounter that we all witnessed. And they had a huddle. They had how did you guys feel? What happened? What, And I think that was really good. I guess it didn't go deeply into emotional struggles. It was just kind of
at least you're checking in.
It does, yeah.
At least you're checking in.
And I think that was the only one, unfortunately. I haven't really done much A&E shifts since then.
Don't go there. But we actually need to start wrapping up because this conversation has been so good. And I think so important. And my last question to you would just be, if you had any advice for any other medical students or even doctors with sickle cell disease, struggling, or even prospective medical students, do you have any words of wisdom or any advice about your journey so far and you could impart onto others?
I guess my advice would be really find and harness your voice. It's really important that one, you vocalize your condition and that your friends and family know what you're going through. If you need support, prayers, help, that people actually know your condition. I think that's really, really important. So finding your voice and harnessing your voice, and really, I think for me, this reminds me of what another speaker said in a Melanin Medics event previously, the International Women's Day one, and little plug. But she said find and harness your sphere of influence as well. And I think that's something that really spoke to me then, is about really understanding where you are in life and how you can make a difference and make an impact in that position. And for me, as a sickle cell warrior, I've been privileged to be and see the inside of the education and the curriculum of our doctors to be, and I can see and hear about when some universities are not quite doing sickle cell education appropriately, and I can see in certain universities when that has been done really well. And I guess from my perspective, this is my sphere of influence in a way, and I have been privileged to be able to help Kiel along with Alex, who's another amazing student in Kiel, to put in a sickle cell case in the year 2 curriculum of Kiel University. And we want to find out how we can be doing that with more universities and how we can continue encouraging universities that are doing sickle cell education really well. But that's my sphere of influence, I guess. And I'm really keen on helping universities really understand like the patient voice, and to be able to put that into video or words, or just even like looking at the cases that you're giving to students and how you're communicating that. That's really important to me, because the education of your future doctors is it's at my core and heart. So I think that's, for me, basically a tie-in to harness your voice, like do what you can in your sphere of influence.
I think that's I'm taking that on board. I'm going to harness my voice. Are you going to do that?
I need to harness my voice.
Tenni's been like, I feel like your life is changing.
Ooh.
My life is this work.
My life is changing.
Been listening to a lot of psychoanalytical, like psychoanalysis of your being in your 20s podcast.
Ooh.
And I actually have been listening to something that's been talking about your like intellectual vulnerability and your emotional vulnerability, and actually using your voice and not being worried about what how people may react to that, because that's them.
Yes.
Yeah.
So being able to talk and not be worried about how, like, if people care about it, or whether what you're saying is important to other people.
Yeah.
But understanding your point. I think even outside of having to communicate your disease, it's all really important facts and things that anyone can take forward. So
absolutely.
Wise words.
Thank you so much for joining us on this episode. I think it's been great.
I've loved it.
It's been great having you. We might do part two.
So excited.
Yes, thank you so much for listening, guys. Catch us on our socials: Instagram, Twitter, Facebook, LinkedIn, TikTok. We're everywhere.
And do you want to plug your socials as well?
Absolutely. You can find me on TikTok and Instagram at FejiroX, and you can also find me on YouTube at Fejiro Talks. And I believe that's all.
You're on TikTok as well, right? You said TikTok?
Yeah, I said TikTok. And then if you want to connect with my social media agency, we are at the Rika Collective.
Sweet. Thank you so much for joining us.
Bye.